We bring you a piece by piece breakdown of everything that affects you and the next person.
And to make sense of all of that,
Get up to speed with essential stories and see the big picture. Only on Freshly Pressed on the Smooth Breakfast every weekday from 7:30 a.m.
Smooth.
My name is Johnny Drill, and for the best of soul, R&B, jazz, and a bit of folk music, keep it tuned in to Smooth 98.1.
I'll be back for you.
This is Johnny Drill.
Make you wait for me, my dear.
Smooth Health on the Drive.
It's a global observation that helps raise people's awareness
Get
of
health
cancer.
information and tips for optimal well-being.
How to prevent it, detect or treat it.
This is Smooth Health on the Drive.
And you're listening to Smooth 98.1 Love Music, Love Life. You are welcome to the Smooth Health on the Drive today. My name is Judith Atibi.
I'm Kyrie Baker.
The Smooth Health is brought to you by Evercare Hospital. All right, so to be part of the show, you can join the conversation via our WhatsApp and, of course, our telephone line. And we are streaming live on YouTube. So go stream us live right now on YouTube at www.youtube.com/smooth981FM. You can also join the conversation and you stand a chance to win 10,000 naira worth of voucher that goes to your very first consultation at Evercare Hospital. So Kutsi, it's Evercare Hospital. All you have to do is ask questions today on the show, and the first three callers stand a chance to win. All right, so our telephone line is 014489981. Again, 014489981. You can also call us up in the studio on 01, or better still, send us a WhatsApp message, I beg your pardon, to 0809444091. We have with us in the show today Dr. Solomon Ufemo. He's been a general dental practitioner since 2018, trained in the University of Benin Teaching Hospital, Uniben, with core interest in preventive, interceptive, and corrective dentistry, trained to carry out procedures like surgical tooth extractions, root canal treatment, crowns and bridges, prophylactic scaling and polishing, and decaying tooth restoration and teeth whitening and bleaching. He has been exposed to patients of all cadre of society, including international HMO patients, and worked with a number of hospitals now present, and is now presently in Evercare Hospital at Lekki. And he joins us today to talk about dental caries from nothing to something.
Hello, doctor.
You're welcome.
Yeah,
Good afternoon.
Yeah, good afternoon.
Wow, so
Good
much
afternoon.
accolades. So much accolades. Just you alone.
You're
All right.
welcome.
Like we mentioned just at the start of the show, if you want to ask questions, okay, reach out to us up on our WhatsApp platform, 0809-444-0981, and call the studio lines. We'd love to hear your voices, okay, 0144899981. So, doctor, I remember when you walked in, the first question I asked you is, so you're a dental surgeon?
Yeah.
And you said yes. And I'm like, so is it a fun job? But generally, outside the fact of knowing that, is it a fun job? I'd like to know, and I'm sure that a lot of people out there would like to know this. Who is a dental surgeon? And also, what are your focus areas as far as oral health treatment is concerned?
Okay, a dental surgeon is an individual that has been trained and is licensed to carry out dental procedures and also diagnose and monitor dental situations. So that's it.
Okay,
All right.
That's it. Just like that.
So you are trained, you are licensed, and you are actually aimed at diagnosing, managing, and also managing dental conditions, and also giving basic oral health education to people like we are doing here right now.
Awesome.
Now, when you look at the topic for the day, it's called dental caries, right? So, what is dental caries, and what are the causes of this? I don't even know there's anything called. I didn't know there's anything called dental caries. What is that?
So dental caries is basically what we know as tooth decay.
Okay. All
Yeah.
right, let's call it
So-
tooth decay then. Okay.
So, dental caries basically is a post-eruptive disorder. So, when you have holes on your teeth, starting from the outer layer, which we know as the enamel, and this progresses. Yes, from the beginning, that is dental. When it starts from the enamel, it's already dental caries. So it could progress beyond the outer layer, which is the enamel. It goes down to the inner layer, which is the dentine. Even when it gets to the pulp, then it's just a straightforward transition, and it just keeps getting worse until the patient starts to manifest with pain.
But
So-
how do we know that it gets worse? Is it from a pain or from like a rust, or how do we know that it gets worse?
Yes, you physically you would see that okay, you're having this discoloration, this crack or this defect on your teeth when you look in the mirror. But as it progresses, when the enamel is exposed, the outer layer is exposed to the enamel, it gets to the dentine, and once it gets to the dentine is exposed, you start having this shocking sensation, which at the beginning could be sharp, could be short, and could actually make you feel uncomfortable when you take some stuff that could
Like cold water?
cold water, sugary substances, sometimes even hot water, and this could just start when you take that provocating agent like cold water. But it could stop once you get the cold water out of your mouth, but it could progress from there. To
Can it
just,
totally stop for no good reason?
it's possible for it to stop when you take that provocating agent from your mouth, but it just keeps going down the hill and it can get worse by starting without you taking anything like cold water or sugar and stuff.
Because I have a story. A few months ago, I don't know, maybe 8 months ago, prior to this time, I used to have, so whenever I'm chewing something, maybe gum, I find that, I would have this shocking sensation on my teeth, right? And then I stopped. And, till now, no problems. Everything's just fine. So that was why I was asking that. Is it possible that, you might be feeling some type of sensation and then it just stops for no good reason?
Yeah, the feeling that you're getting from the gum actually was from the sugary substance in the gum.
Okay.
Because of the osmotic pressure from the sugary substance in the gum that actually triggers the dentinal tubules from your exposed enamel now communicating with your dentine. When that sugary substance gets it could even be chewing gum, it could be ice cream, it could be something sweet.
Okay.
So you stopped taking the sugary substance, stop taking the gum, then definitely you stopped exposing yourself to the provocating agent. Yeah,
Alright.
that's why you stopped feeling that. However,
I've stayed away from gum, so no more gum for me.
but you should get it checked.
Oh yeah, definitely. Okay, so here's another question we'd like to know. According to the World Health Organization, based on a global burden of disease study now, untreated dental caries in permanent tooth is the most common health condition across the world, right? So we would like to know, what are the symptoms and risk factors of this disease?
Okay, the symptoms first thing first, pain or shocking sensation. The patient gets to feel pain, shocking sensation. Pain from when you take some, like we discussed, when you try to chew or you try to bite, or you take some cold stuff or sugary substances or even acidic substances, like maybe you take some like mango, something like oranges or pineapple or stuff like that. You feel that shocking sensation. And of course, when it's more exposed, now it's communicating with the inner layer, talking about the pulp, you feel pain when you try to chew or when even normal water becomes quite unbearable. When you are driving, even the air conditioner,
Wait,
when
normal water becomes
yes,
unbearable.
Yes, it gets that bad.
Oh, wow.
For people, and it gets to a point, even when you don't expose yourself to any of these provocating agents, you just can't feel comfortable anymore. It disturbs your sleep at night. And yes, this is really something quite serious. Then physically, where in the morning you want to brush, or at night before you go to bed you want to brush, you look in the mirror, you notice that there is this darkish patch or this brownish patch on your teeth, and it just wouldn't go by toothbrushing. Something is really happening there, and yeah, you're already having that decay going on, so you just have to come around to get it checked. Yeah.
Wow. Wow. Well, so the World Health Organization also confirms that, 530 million children suffer from dental caries of primary health, right? So how can dental caries be prevented in children? And don't say it. I know you're going to say it.
Braces?
Candies and chocolates? For them to stop eating it?
Interestingly, if you have good oral hygiene, like you brush morning, and you brush in the morning, then before you go to bed, you brush, then you visit your dentist once in 6 months, you pretty much can eat anything you want to eat as long as it's edible, including, yes, chocolate.
So brushing your teeth every single
Morning and night.
Brush morning, in the morning, then at night before you go to bed, the last thing that should enter your mouth, apart from water, should be your toothbrush, your toothpaste. You brush, then you floss properly, of course, and it's advisable for you to floss before you brush, all right? So you floss, you brush, then you visit your dentist once in 6 months. I would check and see if there's do your scaling and polishing once in 6 months and check if there's anything that is to be restored from the beginning. Get it restored and you're just good to go.
Good thing you mentioned scaling and polishing. I want to know the difference. I know that there are people that actually don't know the difference between scaling and polishing and whitening. So, what is the difference? And are there health risks involved? Because I was having a conversation. In fact, I was watching a YouTube video and then they said something funky about whitening. So, I just wanted to clarify that. Well, what is whitening about?
Okay, whitening is pretty much bleaching, what we refer to as bleaching.
Okay.
Use of chemical and light radiation to react with your enamel and make it more lustrous, make it shinier, make it whiter.
Okay.
But scaling and polishing is not actually making your teeth whiter, but it's bringing out the natural color of your teeth. So
Okay.
what you are getting out during scaling and polishing, you are getting out food particles, you are getting out plaque, talking about these deposits in your mouth,
Okay.
getting out calculus. Calculus, pretty much, they are harder than the plaque. The plaque, pretty much, you could scrape them out with some stuff like some people try at home, which is not advisable. Your toothbrush will just be fine. But calculus, when it becomes hard and attached to your teeth surface, you pretty much can't get that out by just toothbrushing. So you need to see your dentist. So yes, scaling and polishing gets rid of plaque, calculus, food debris, while stains, of course, whilst the tooth bleaching happens, that gets to happen after the scaling and polishing, and that is making your teeth whiter. Yeah. So
All right.
Very interesting things here. You can join the conversation. Send us a WhatsApp message to 0809 444 0981. Again, 0809 444 0981. You can also send us, you can also call us up here on the studio on 01 448 9981. We're streaming live on YouTube, so go onto our YouTube platform and check us out live at Smooth 981 FM on YouTube. All right. So, in what ways can adults prevent dental caries?
yes, you start with the good oral hygiene, just like in children. Then, of course, make your appointment quite a habit. See your once in 6 months, 20 minutes, 50 minutes visit. The dentist gets to clean your mouth and clean your teeth, and if there's anything starting, it's restored right there and there. So it's as simple as that. Brush in the morning, you brush at night before you go to bed, you floss, you eat, of course, good food that will not really give you this. Don't bite on things that are too hard, so you don't end up cracking your teeth. Don't try to use your teeth to open corks from bottles and all that stuff. Then you see your dentist and you do a routine check once in 6 months, and it's as simple as that, and you're just fine. Yeah.
Got a message from Ali. He says, yesterday morning, just when the minty flavor taste of my toothpaste is still very much in my mouth, I had sweet pineapple and just one bite. The shocking sensation was there throughout the whole day, even when I had rinsed my mouth. I couldn't eat anything crunchy. Even the slightest crunchy food gave me shocking sensation until later in the evening when I started eating oily foods.
Wow.
Do you think palm oil is a sort of solution to curb shocking sensation?
Okay, now what the palm oil pretty much did was that the palm oil sealed off something we call dentinal tubules. When your enamel is the outer layer is exposed as the enamel, now your dentin is there, just waiting to give you that shocking sensation when it's exposed to substances. Now the oil actually came in to seal off that dentinal tubule, now creating a barrier between the dentin and what you have to eat. Hence, he stopped feeling that shocking sensation. For him to still have that shocking sensation lingering after he stopped whatever provoked it, that means what he has is now a condition we call irreversible pulpitis.
Oh, wow.
So inflammation of the pulp tissue, yes. So though it stopped after he took something that was oily, he still needs to come in. So we do, at this stage now, it's still good news. We could do, after proper examination and radiographic exposure, we could do a simple filling for him and he get his life back and enjoy his meals.
All right, Ali. So if you heard that, we're giving you first things first. Because you sent in a message first, you get a voucher courtesy Evercare Hospital, so you can get that checkup that you've been looking to get concerning your teeth, amongst other things.
Yes, indeed. We're going to take more messages here. Let's see if we can. So that's from
Ali? So this is from Noah.
Yeah, this is Noah, and it goes, "Hi, doc. Can toothpaste help in dental caries, and what content must we look out for?"
Yes, toothpaste can help you to cause what in what we call arrest the caries. When it's just starting, when the caries is just starting at the enamel level, incipient caries just beginning, toothpaste can cause what we call arrested caries. Now, the content you look out for in your toothpaste basically is fluoride.
Okay.
Fluoride is any toothpaste that does not contain fluoride. Please just get another toothpaste
But
that
wait,
contains
how?
fluoride.
I was going to write that. How do we know? But then again, is it written on all toothpaste?
It's written, it's expected to be written. And I always tell people your toothpaste should have some basic things. Most importantly, your toothpaste should have contain fluoride, should not be expired. If you are buying in Nigeria, it should have NAFDAC number.
Okay.
You should be able to get it to buy across the store where you are, and you should be able to afford it. So one thing is having to use a toothpaste, but make sure when you are going somewhere, like maybe you are leaving Lagos, you are going somewhere else, you should be able to get that particular brand of toothpaste you like to use to buy in that particular place. So I come again, it contains fluoride, NAFDAC approved, so there's
Okay.
no number written on it. It's not expired, of course. You can afford it.
Okay.
And of course, you can easily get it to buy across the stores. So, yes.
There's also an issue of charcoal toothpaste, right? Because I've seen this around. People sell this on Instagram. They say, "Oh, you want teeth whitening? Buy charcoal toothpaste." So, I mean, what are your thoughts about that?
Activated charcoal toothpaste.
Because I've seen different ones.
Yeah,
So it's
yeah,
like,
I know. Yeah, and they
okay.
put this activated charcoal. I'm like, what? Why is it
How's it
activated?
charcoal
What
to
makes
start
it
with?
activated? Is it not the same charcoal that you used to make
Oh.
smoky jollof rice?
So actually, activated charcoal commonly is used to actually, when some people are exposed to food poisoning, all right, so people use activated charcoal to actually control that before. It's like a first aid remedy before you rush the patient to the hospital. So, but activated charcoal also, it has some abrasives in it that could wear out your outer layer of your teeth.
What does
will-
that mean?
How abrasives like something that can scratch off. It's sort of
Like
soft-
exfoliating.
Exfoliating, yes. Wearing off the outer layer. And when you do that, what happens actually is that it just takes out the outer layer that might be causing extrinsic stain, external stain from your teeth. Okay? And you feel like, oh, it's whiter. Actually, what it just did, it exposed the natural color of your teeth. Actually, did not make it whiter. But the danger there is
I was waiting for you
using
to say
using that will expose your enamel because it's not professionally done. And when it exposes your enamel, you start having shocking sensation, which which could just be the beginning of the cavity, the decay. Now the caries is getting much more worse, and it just keeps getting worse from there. So we advise people, don't try this at home. Don't even try it. We don't use activated charcoal even in clinic for dental remedies. So
Doctor, is activated charcoal different from the regular charcoal that you see out?
yeah,
Because some people can use it to grind it. And
it's the regular charcoal. Pretty much when you burn wood, it's when you have left, you have some ashes, you have some charcoal.
Yeah.
But activated charcoal is different. Of the kind of wood that you use is different to generate activated charcoal, and they add some little chemicals and they just tell you some little abrasives, eggshells. They just mix whatever they want to mix for commercial use. But yeah, it's this activated charcoal that, like I said, you can get it to buy over the stores, or as long as it's approved, of course, by NAFDAC. Don't as long as you're buying in Nigeria, approved by NAFDAC. Okay, this is something that people can use for their to checkmate some basic things like food poisoning and all that stuff at the early stage. Yeah.
We do have to go on a quick break though, but I just want you to say one thing concerning this one. How about salt and toothbrush? People that use salt and toothbrush. No, because hey, this is the norm, right? People use salt and toothbrush in this country. So how about that?
Okay, depending on the level of salt that you are using, salt could be bacteriostatic in the sense that bacteria contained in plaque and calculus in the mouth, the deposit in the mouth, salt could come in there and try to stop the bacteria from proliferating. However, salt just doesn't contain fluoride like we would want. Some salts from the commercial salt across the counter, they contain fluoride, so people can be able to use it like our normal dairy products. You get soda also contain fluoride, but the fluoride is not just enough to give you that effect you would get from your regular toothpaste that meets the criteria I've already listed. So you need some level of fluoride that salt you can't just get from your normal table salt. So I wouldn't advise you to brush with salt. Just get your toothpaste.
All right. If you just joined us, you haven't missed too much though, but we're talking all about dental caries today. From nothing to something. Our very special guest is Dr. Solomon Ufeman. He's a dental surgeon. And of course, this is Smooth Health. It's brought to you by Evercare Hospital. Let's go on a quick break. When we get back, we'll do some more talking.
Smooth Health on the Drive.
So Lagos, if you didn't know, now you know.
Stay tuned.
I've used activated charcoal for a very long time.
What do you love about it the most? Is it the suspense-filled moment before the unexpected happens?
I don't buy things.
Or the fun and cruise you catch with it? is it the drama that comes with different personalities in one house? Or the inevitable basbos?
What did you ask, bro?
I know you don't like me. Tell me. Say it with your chest.
Whatever moment you're looking forward to this season, one thing is for sure. We're here for it. Enjoy all the exciting moments of your favorite reality TV show with a chilled, refreshing bottle of Pepsi. Pepsi, for the love of drama.
Pepsi, for the love of it. Win amazing prizes like a paid trip to Dubai for 2, PS5, mobile phones, ACs and laptops in the ongoing Premier Code Chill and Win promo running from 2nd August to 30th October. Just text your unique code to 1393. Terms and conditions apply.
Smooth health on the drive.
So Lagos, if you didn't know, now you know.
Stay tuned.
Look, when it's done professionally, it's not actually intelligent bad.
And you're welcome back. You're listening to Smooth, the 98.1 at Love Music, Love Life. You're welcome to the second half of the drive time, or better still, of the Smooth Health on the Drive. Smooth Health on the Drive, and is sponsored by Evercare Hospital. We have with us Dr. Solomon Ufemo. He's a dental surgeon from Evercare Hospital, and he's here to talk to us about dental caries from nothing to something. My name is Judith TV.
I'm Katie Baker. Don't forget to get those messages in. In fact, we see a number of them, so I think we should get to them.
Yeah.
If you want to get to, if you want to ask questions,
Yes,
send them
for
to
a doctor.
0809-444-0981. Cruz comes in to say, once in 6 months, is it not only food items and snacks that are bad for
Our
our
dentition.
dentition? What's the impact of body fluids on our dentition? And okay, Neil comes in.
So you want to answer that question first?
Okay, so when you talk about body fluids, there are some body fluids, of course, I can't mention on air, but it's not about body fluids like saliva. Okay, of course, not about your tears, your sweat, pretty much you shouldn't expose your mouth to your sweat. You shouldn't expose, you already have saliva in your mouth. You shouldn't expose your mouth to tears. So body fluids are there to do their function. So don't introduce what's not supposed to be in your mouth into your mouth. So
Wow.
yeah.
Wow.
Did I say no? Wow.
It's okay. Well, we have this message here from Esther Olua Yemisi, and she goes, is it true that we aren't supposed to wash toothpaste from our mouth afterwards?
Okay, and
when we
this
finish
is
brushing?
quite an interesting one. So let's get it straight now. After brushing, your toothpaste actually contains fluoride. We expect part of that fluoride to still be in your mouth. So after brushing, you can spit out the toothpaste, and if you are still not comfortable with the content of toothpaste in your mouth after spitting out, you can now rinse mildly. Not the essence is not to rinse out everything from your mouth, like.
Oh wow.
So you just rinse mildly to a point where you are comfortable with the content of toothpaste that's left in your mouth, because the fluoride that is in that toothpaste is ready to work with your enamel.
So let's just get this straight. You finish brushing, you brush, and then you're done. You leave it out there. You just leave it there.
Okay,
You brush,
cannot.
you spit out.
So sorry. I cannot.
You brush.
You need to be sure.
You brush, you spit out, you wipe your mouth. If you're not comfortable with what is left in your mouth, the toothpaste that's left in your mouth, you can rinse mildly with little water and spit out until you are quite comfortable.
Oh, wow. This is a revelation.
Yes. We have more messages here. This is Jay from Toronto, and he goes, hey guys, can you ask the dentist what's some of the best natural remedies for teeth whitening from coffee and tea? Also, why is it a common practice in Nigeria not to remove wisdom teeth in teenagers until they become worrisome at older age? And he goes on to say, Appendum is adding something. Can the dentist also speak to the type of toothbrush we should be using? Contrary to popular belief, soft toothbrushes are better for our teeth, and that's from Jay from
Soft toothbrush or
Toronto.
hard toothbrush?
Okay, now for the remedy for tooth whitening, it's simple. Tooth whitening is a professional procedure that should be done by a licensed individual that's trained to do it. Not every individual that walk into the clinic will do tooth whitening for. Before we do tooth whitening for you, must have done scaling and polishing for you. If you are not comfortable with scaling and polishing due to shocking sensation from the procedure, you are not a good candidate to have tooth whitening done. Otherwise, it will expose you to even much more sensitivity. So when you sit at home and you just take agents and you start bleaching your teeth, you might be exposing yourself to so much more. So see a professional, be assessed by a dentist, then you cannot progress from there. But if you're having shocking sensation and you still insist on getting the whitening done, we can manage that shocking sensation first within a week or two. Then when you return with less symptoms and of course less signs, then we cannot progress to do your whitening for you, because you were saying something earlier. Tooth whitening on already sensitive teeth will make it even worse.
Oh, wow.
So you must not have that sensitivity going on before you progress. So if you have sensitivity going on, you should not attempt it. So you better see a professional to do your whitening for you, not just sit at home and get some light and just start doing some stuff,
Wow.
So talking about the removal of wisdom tooth, yes, with wisdom, the third molars actually they pose so many problems. Okay, and I know in some countries people just walk in and they take it out electively because of the decay and the position and all that. But in Nigeria, people don't often do it for some reasons which I can tell because of my practice. Number one, some people are scared of seeing the dentist. They just believe it's about pain. But there are modern ways of doing these procedures now that surgical extraction pretty much for some people that I have done this procedure for. During the process, you do not feel pain. It's during the healing process that you feel some pain that will manage with painkillers. And of course, you'll be all right within 3 to 4 days. Now, not coming to get your number one, fear. People are scared to see the dentist. Then secondly, some people don't just like to come to get their wisdom to taken out until there's pain or there's a reason. And even when there's pain, they just try to manage it until they can't help it anymore. And some people go as far as abusing painkillers before eventually they come. And unfortunately, some people just go to other professionals that are not dentists to manage dental related cases, and they have third molar related issues, and they go to see a practitioner that gives them antibiotics and painkillers, and they feel okay. Then it comes back worse after some months. So fear, pain, and maybe lack of information. But for those that know, when you have your wisdom teeth and you know they're impacted, if your wisdom teeth are impacted, like when you say impacted, they didn't grow out fully, or a part of the flesh is covering it, food is packing in there, just walk up, meet a dentist, we'll assess it, do radiographic investigation, and discuss your treatment plan with you going forward. And of course, we'll get it out.
When you said doctors don't like coming out, oh, sorry to cut you short. Yeah. Go on.
So for the type of toothbrush I will advise, toothbrush that is medium, please. It should be written on it. We have soft, we have medium, we have hard. I totally discourage use of hard toothbrush. Some say smoker's toothbrush. You don't have to feel that
extra hard.
You don't have to use that. Toothbrush can pretty much get out the plaque in your mouth, get out the material, the food debris in your mouth. If it doesn't get out, you use your dental floss. So for the ones that your medium toothbrush can get out, you see your dentist within 6 months. You come over, we do your cleaning and polishing for you, and you're all right. So hard toothbrush will end up giving you things like gingival recession. Could even make gingival recession, your gum starts filing down, even file off the part of your enamel, exposing you to even much more caries. And it's just bad news all the way. So hard toothbrushes, if you ever see those things, just turn your face away. Go from medium to medium.
So for guys out there that like to buy smokers extra hard, because I see it all the time, extra hard brush. Stay away.
I don't know how someone wants to inflict all that pain on themselves. Like, oh my God.
Well, some people just actually like to feel that feeling, have that feeling that it's there. It's when they feel it scratching them that it's really working. But with the right toothbrushing technique, we have right toothbrushing technique, which we often teach our patients after scaling and polishing, from gum to tooth movement, and just a very fascinating way of brushing. We'll teach you when you come to the clinic for scaling and polishing, or if we're on maybe visual or if we're visual mode right now, I would have shown you guys with a model or something. But then the head of the toothbrush should be pointed. It's pointed in a way that it's triangular somewhat or rectangular, but pointed in a way that you can get to the last molar to clean that area. The handle should be long. So a medium bristle toothbrush, medium, it should be written there. Soft is for children, but for adults, medium, please. Never hard.
Speaking of, I lost my thought there. Just continue. My brain just froze.
Mojisola says, which one is the wisdom teeth?
The third molar. You have 3 molars in the mouth. Some people actually do not have third molars. It's just naturally. It's not there. It didn't develop. Or it developed but it's buried inside the gum or inside the bone. That's impaction. But the third molar, when you open your mouth, you count your teeth. You're supposed to have 32. So when you count from the front towards the back, you count like from the middle, from midline, you count 1, 2, 3, 4, 5, 6, 7, 8. The number 8 to your right down. Number 8 from middle to your left down. Number 8 from middle up, your upper teeth, middle to your left up. Number 8 Just like so, you have three molars. The third molar, when you say wisdom to your third molar, and this they erupt between the ages of about 17 to 21. They must have popped up. So, for those that are meant to have
I think I
them,
must have grind my own to powder and sleep just because of the anxiety I have on a daily basis. Speaking of doctors, what are you talking about toothbrush and brushing from up to down your gum and everything else? What do you think about electronic toothbrushes, right? Because I like those ones. I like those ones.
yeah, electric, they are faster to use, and of course, we advise them for people, special needs patients, special needs individuals like maybe with the Down syndrome, or maybe they have issues with dexterity. They use toothbrush. Yes, toothbrush could what it does is it has an oscillatory movement.
Yeah,
Okay,
because it goes.
so it just massages from your gum to your tooth surface, and the movement is rotary
it's
in nature.
circular, yeah.
So it doesn't apply so much force on your enamel enough to cause any form of abrasion or damage, and so it's electric toothbrush. It's fine too, but if you have good dexterity and you are not a special need individual, you should just take your toothbrush and do your
There's
thing.
something I've noticed on Instagram too, and we find this a lot in these spas and amongst other places, right? So they put this thing in your mouth. It shows this blue-white type thing, and they say it causes teeth whitening. How does that work?
Also, that was the bleaching light. Okay, it's to activate you. What you apply, you apply this gel or this chemical
They
on
put
your
it first
teeth.
and then they worry
Okay,
on it.
so that gel on your enamel reacts with your enamel, the outer layer of your tooth. Then the light activates the chemical to create that bleaching effect. So that blue light is reacting with the chemical that is on the substance, the fluid, the gel is on your teeth to create that bleaching effect.
Is that a good thing?
Like I said, you must be assessed. If you are not a good candidate for bleaching, and you are not all, take note, if you want to say you want to bleach, for example, you have intrinsic like stain from inside it, you can't, that stain won't bleach it. Because the stain is not from outside. It's from inside. Maybe you have something like they say tetracycline stain and you want to bleach it, it will not be uniform if you try to bleach it. Some parts you have white patches, brown patches here and there, and it comes back. It's still reversible. You still come back to the natural color of tea that you have. So
We have tons of messages here, so we're going to take them all together because we're really out of time, right? So this is Ovrum, and he goes, wow, for all the years, bro, we rinsed the mouth with Tonda and to ensure that every bit of the toothpaste is cleared out. And then he goes on to say, the impression was that toothpaste is soap. Are you now saying a bit of that taste and foam should be left in your mouth for it to work properly and achieve the purpose of mouth cleaning? I beg, I need you to be clear on this, because the implication is that a whole bunch of us have been swimming in ignorance. So please clarify. It goes, more when I rinse my mouth after brushing it, it's like a volcano of water is in the mouth. Then after the thunderous riots in the mouth, you shine the 32 with this sense of accomplishment. And that's from Ovram there. And this is at Shei, and it comes here with, I usually have this sharp tooth sensitivity whenever I take anything cold or hot, and a swollen upper gum every morning. It's been on for decades. What do you think it's the reason? And that's from Shei there. This is Bassi from Lekki, and it goes, does tooth whitening need to be done regularly, or is it a one-off? And that's from Bassi. And this last message is from Ali, and it comes back with, I'm a bit of a muncher, and
the dentist have told me that I've overused my teeth, hence the reason for my teeth sensitivity.
Yeah, but I hear that
the
feeling the tooth is not a lasting solution to tooth cavity
cavities
or
or
tooth holes. Is that true? And it was also complaining earlier in his message here earlier. It was saying that also anytime I go for tooth scaling and polishing, my teeth becomes very sensitive after the session. And he goes on to say extremely sensitive, that I wouldn't be able to eat anything until a sort of food feeling like the doctor mentioned. Why it's that, and he goes on to say, I thought polishing and scaling is supposed to curb whatever issues one is having. Should I stop doing teeth polishing and scaling altogether?
I think it's a no-brainer, really.
That's a no-brainer question there, but I'll leave it for you, doctor.
Doctor, so you got a minute to answer, because we're totally out of time.
We're
totally out of time.
okay, I'll just rush this for you. Now, how you rinse after brushing? Rinse just well enough that you are comfortable. But if you are comfortable leaving some, not rinsing everything. If you are comfortable not rinsing everything from your mouth, it's fine. However, if you know you can't take anything in your mouth, or you can't leave any toothpaste in your mouth, Follow the right toothbrushing technique by about 8 swipes per tooth. When you do that 8 swipes per tooth from gum to tooth on each tooth across body, you must have spent an average of about 5 minutes brushing. That duration you spent brushing is fine enough for the fluoride in the toothpaste to actually do its job. Then when you eventually rinse and rinse as much as you want to rinse, the fluoride must have done something in your mouth, on your teeth, with the duration you have spent brushing. So that duration is very important. Now, talking about the sharp tooth sensitivity, if yes, the sharp tooth sensitivity you are having because your enamel is exposed. The outer layer is exposed. That's why you're having sharp tooth sensitivity. Like I said at the beginning of the program, once your enamel, the outer layer is exposed, your dentine is now exposed to all form of trauma, and you start having all that when the dentinal tubules are exposed and all that. So talking about tooth whitening, how often should you do it? This is what, if you really want to have white teeth and move about having your teeth, there are options that will not expose you to chemicals and bleaching lights and all that. You can do, we have veneers.
Veneers?
Yes, veneers. Like, let's say your fingernail is your natural teeth.
Okay.
Putting artificial nail on your fingernail is the veneer. So like you're putting a covering over your natural teeth, and you can
I've seen those videos. Some Dubai doctors have been making a lot of money from them.
Yeah, beautiful procedure.
And it doesn't stain your teeth, no sensitivity.
It's a covering.
It's just to cover your teeth and you're good to
and
go.
it's fantastic.
Veneers, it's so good.
You know? So though some people might say their veneers, it may not last. It may not last. It's comfortable if it's done by a good dentist. You should be comfortable. If I do your veneers, you should be comfortable.
Yes, sir.
So now if you can't take veneers, you can do what we call crowns. Okay. Crowns. You can do zirconia crowns, porcelain crowns. They are permanent. We just like people go to Dubai and come back with this gold or silver.
Yes.
We're not giving you gold nor silver. We're going to give you the color that is tooth colored. Okay.
I think I like the color.
Yeah. So crowns is permanent. You can use that. Fantastic. So
what
the
about
other
grills?
Options. So
do you want grills?
Diamonds.
So talking about overusing of that, they said because the shocking sensation due to overusage of the teeth. It's called attrition. Due to some people that are bruxists, okay, they keep gnashing their teeth and they're exposing their teeth to maybe acid and all that stuff. So it keeps filing out, wearing out over time with age. That's attrition for you. When the enamel will get exposed and the dentine will just be exposed to the trauma. So for the filling, if it's properly done, it should last. But if the attrition has gone way, way low down the tooth structure, then you put a covering on it, like I mentioned, crown. You put a crown over it, and you are good to go. All right. So for the sensitivity after scaling and polishing, please.
Totally. Totally.
Okay.
Like checkbook.
Check. We're out of time.
Please, you need to tell us how to reach out to you.
Yes. On how we can reach out to you there.
Okay. So how you can reach out to me? You can use the number first of the location. The location.
To get to Evercare. How do we get to Evercare
That's
Hospital?
number 1, Admiralty Way, Bisola Durosimi, Eti Drive, Lekki Peninsula, Scheme 1, or Lekki Phase 1 in Lekki. I come again, number 1, Admiralty Way, Bisola Durosimi, Eti Drive, Lekki Peninsula, Scheme 1. Okay, once you enter Lekki Phase 1, the building, you won't miss it.
Building.
You won't miss it. It's just staring at you at the entrance of Lekki Phase 1. So the website is www.evercare.ng. www.evercare.ng. And the telephone is 08139 850 710. Again, 08139 850 710 telephone. Then the email is info@evercare.ng. info@evercare.ng. And you can also book online, book an appointment to see any of the consultants, any of the doctors online using just follow onlinebooking.evercare.ng.
Okay.
Go online, just type it onlinebooking.evercare.ng. Just go there and you can book to see any doctor and come in and see us.
Oh, that's wonderful.
Totally out of time. But thank you so much, Doctor.
Thank you for coming on here and joining us today on the show. You can reach out to them, find them at their location is number 1, Admiralty Way, Bisola Durosimi Eti Drive. That's Durosimi Eti Drive, Lekki Phase 1. You can visit their website is www.evercare.ng. Again, evercare.ng. Their telephone number is 0813-985-0710. That's 0813-985-0710. You can also email them at info@ever That's info@ever.ng. You can also check out the online booking. It's onlinebooking.evercare.ng. Again, onlinebooking.evercare.ng. That brings us to the very end of Smooth Health on the Drive. Doctor, thank you. Stick around. More music is coming up on the other side. Stay with us.
Stay close. This is Smooth 90.1.
Smooth Health on the Drive.
It's a global observation that helps raise people's awareness of
Health information and tips for optimal well-being.
how to prevent it, detect, or treat